Importance and application use of OBGYN ultrasound. The course objectives for this course are students will be able to verbalize why OBGYN ultrasound is important. You'll be able to verbalize the importance of OBGYN ultrasound in screening and diagnosis. You'll be able to verbalize the different applications of OBGYN ultrasound. And you'll be able to verbalize the common gynecological conditions that can be diagnosed with OBGYN ultrasound. So why is this topic important? Obstetrical and gynecologic or OBGYN ultrasound is a critical diagnostic tool in women's healthcare, providing valuable information for monitoring pregnancies, assessing reproductive health, and diagnosing various gynecological conditions, such as early pregnancy assessment, fetal development monitoring, assessment of fetal well-being, detection of birth defects, gynecological conditions, infertility investigations, guidance for procedures, and postpartum evaluation. The importance of OBGYN ultrasound in screening and diagnosis. OBGYN ultrasound plays a crucial role in the screening and diagnosis of various conditions. It is used to monitor the course of pregnancy, assess fetal development, and detect any abnormalities. Ultrasound imaging is non-invasive, safe, and does not use radiation, making it an essential tool in prenatal care. It allows healthcare providers to obtain real-time images of the fetus, uterus, and ovaries, providing valuable information for the management of pregnancy and gynecological conditions. Ultrasound imaging can aid in the early diagnosis of conditions such as uterine rupture, fetal chromosomal abnormalities, and postpartum endometritis, contributing to the reduction of maternal and perinatal mortality. The World Health Organization recommends routine ultrasound scans as part of prenatal care, highlighting the importance of ultrasound in pregnancy management. Overall, OBGYN ultrasound is integral in providing valuable diagnostic information and contributing to the well-being of pregnant women and their babies. Ultrasound is very, very amazing, and it definitely helps to progress the diagnosis of things and to progress the treatment options if there's any issues that should arise. It's a very valuable tool and something that amazes me every day. Applications of OBGYN ultrasound. In obstetrics, ultrasound is used to confirm pregnancy, estimate the gestational age, monitor the fetal well-being, evaluate fetal development and anatomy, assess the fetal growth and the fetal lie, if the fetus is lying breech or transverse, or if they're in a head down position, cephalic, anything like that. It helps monitor the fetal heart rate and blood flow, looking at the umbilical cord blood flow, checking if it's a patent and umbilical cord. It evaluates the cervical length, assesses the amniotic fluid levels, and diagnoses issues like placenta previa. In gynecology, ultrasound is used to diagnose various conditions such as uterine fibroids, ovarian cysts, endometriosis, pelvic inflammatory disease, adenomyosis, ovarian torsion, and cervical polyps and endometrial polyps. Uterine fibroids and ovarian cysts are very, very, very common and something that's seen very often on gynecological or pelvic ultrasound. Transvaginal ultrasound is particularly useful in detecting and diagnosing these conditions as it allows for closer contact with the organs of interest. So other applications of ultrasound include monitoring follicular development, assessing ovarian reserve, and measuring endometrial thickness. Abdominal ultrasound may be needed to better assess the pelvic structures that transvaginal ultrasound cannot visualize. So if a patient has a very large uterus due to maybe just being postpartum or having many fibroids that are enlarging the uterus, it may be very limited to what you can see on transvaginal. So abdominal comes into play with that. Reproductive medicine, it helps with monitoring ovarian stimulation and assisted reproductive technologies. helps with follicular tracking during fertility treatments, helps guide invasive procedures like amniocentesis, CVS or chorionic villus samplings, and other fetal interventions. It helps assist in gynecological procedures such as endometrial biopsy or cyst aspirations. And in emergency situations, a rapid assessment such as ectopic pregnancies or ruptured ovarian cysts and ovarian torsion, it can diagnose immediately. So common gynecological conditions that can be detected by ultrasound include ovarian cysts. Ultrasound can detect fluid-filled sacs that develop on the ovaries, providing information on size, composition, and characteristics of the cyst, whether it's showing benign or cancerous types of findings. Uterine fibroids are non-cancerous growths in the uterus. They can be diagnosed using ultrasound, evaluating their size, number, and location. Common gynecological conditions that can be detected by ultrasound also include endometriosis. Ultrasounds can detect signs of endometriosis, a condition where uterine tissue grows outside the uterus, presenting symptoms like pain and discomfort. Ectopic pregnancy helps identify a pregnancy that was fertilized and implants outside of the uterus, requiring prompt medical attention that can be life-threatening. Adenomyosis is a condition where the uterine lining tissue grows into the muscular wall, causing symptoms like heavy bleeding and pelvic pain, and can be diagnosed through ultrasound. Ovarian tumors, such as both benign and malignant growths, they can cause symptoms like abdominal pain and abnormal menstrual cycles. And pelvic congestion syndrome can be diagnosed by ultrasound with characteristics such as chronic pelvic pain due to enlarged veins in the pelvis, common in women with hormonal imbalances or multiple pregnancies. So in conclusion, ultrasound is a valuable tool in obstetrics and gynecology, providing important information for diagnosis, management, and monitoring of fetal and maternal health. In obstetrics, ultrasound is used to confirm pregnancy, estimate gestational age, monitor fetal well-being, evaluate fetal development and anatomy, assess fetal growth and fetal lie, monitor fetal heart rate and blood flow, evaluate the cervical length, assess amniotic fluid levels, and diagnose issues like placenta previa. In gynecology, ultrasound is used to diagnose various conditions such as uterine fibroids, ovarian cysts, endometriosis, pelvic inflammatory disease, adenomyosis, ovarian torsion, cervical polyps, and endometrial polyps. Transvaginal ultrasound is very useful. It can get up close to the organs of interest. It can also be used to monitor follicular development, assess ovarian reserve, and measure endometrial thickness. Abdominal ultrasound may be needed to better assess the pelvic structures that transvaginal ultrasound cannot visualize. As I mentioned before, if the uterus is too large to be included into the field of view on a transvaginal, there may need to be abdominal ultrasound included. Ultrasound is a reliable imaging technique to identify the formation of maturing follicles and guide intrauterine inseminations, embryo transfers, endometrial biopsies, and other procedures. And ultrasound is a non-invasive, safe, and effective tool that has contributed immensely to obstetrics and gynecology. Although there are limitations to ultrasound, advancements in technology and developments show promise in improving the accuracy and reliability of ultrasound imaging. The continued use and development of ultrasound in obstetrics and gynecology will undoubtedly lead to better outcomes for both mothers and babies.